Welcome back to What in the Health with your co-hosts Fatiha and Rena. Before we begin our 7th episode about how sick I am, just kidding, nasally voice is all thanks to a bug that I caught this weekend. But in all seriousness, we are going to be talking about storytelling in public health. But before that, we hope you had the chance to listen to our editor's note to learn more about some major changes happening to What in the Health. For those who haven't had the chance, or for those that need a refresher, Eric is no longer a co-host on this podcast, and we miss him so much, and we wish him all the best in grad school.
We're also experimenting with how we want to share stories on this podcast, and we'll be moving forward with a conversation style interview, which is different from our previous episodes. So we hope you enjoy this new format, but as always, we're open to feedback and your suggestions. In this episode, we will talk about the importance of storytelling in the field of public health, specifically how we can humanize public health through the stories and experiences of others. We'll start this episode with a discussion on the value of storytelling and its applications to global health issues. We'll close the episode with how young adults can share their own stories and experiences with health.
Today, we'll be speaking with Dr. Patty Mechael, who's a writer and public health specialist who combines her passions for women, technology, science, and the world to inspire children and adults through her writing. Dr. Mechael has a master's in health science and international health from the Johns Hopkins School of Public Health and a PhD in public health and policy from the London School of Hygiene and Tropical Medicine. Among Dr. Mechel's many accomplishments, she has created more than 75 publications on topics within public health and technology in scientific and health journals. She is the co-editor of Health in Practice, Mobile Technology for Health Promotion in the Developing World, and is the author of the Antidotes Pollution Solution, a middle grade fiction collaboration with her 9-year-old son. Thank you so much, Dr. Mechael, for taking the time to join us on this podcast.
Thanks for having me. Really excited to be here today.
All right, I guess before we get started, on a scale of 1 to 10, Patty, how are you feeling today?
I'm feeling a solid 10. I'm really pumped about today's conversation. How are you guys feeling?
I guess if I had to rate myself, I'm like a solid 7. I have midterms coming up this week, but Spring break is coming and I'm excited about that. What about you, Fatiha?
I'd say I'm like a solid 7 or 8. I feel like there's just so much going on that I'm like, feel like I'm being pulled in so many different directions, but spring break is coming. So I'm excited to decompress a little bit.
All right. Well, I'm glad that we're all at least a 7. It's good to hear. So let's just get started. One of our first questions and things that we're interested in is just the sheer vastness of the field of public health, right? There are billions of people, each with a unique story. And so, Patty, how would you decide which stories are worth telling?
Sure. So before I do that, I mean, when you were asking me like how I was feeling, etc. I think one of the reasons why I'm really excited to be doing this podcast is that you're combining the two things that I love the most, public health and storytelling. And so I'm really excited to be talking about that. And both have so many different ways to explore them. So public health is an incredibly vast field, lots of different public health issues, no shortage of challenges that the world is facing from a public health perspective. And in storytelling, there's a lot of different approaches to storytelling that range from personal storytelling to fiction and creative nonfiction. And I think it's really important to kind of like understand the full lay of the land. And so when selecting stories to tell, I think it's really, really important to consider, who your target audience is, what the current context is, what are the most pressing, kind of public health issues that are out there, but also in writing, what people, often will say is you should, speak from experience, that when you're writing, you should write what you know. And so when selecting stories, it makes sense, at least from my perspective, to really think about like, what are the stories that like I can tell, and I should tell, and what is their kind of like relevance to the context in which we're living and existing, and then who is the audience in which I am engaging with in the telling of the stories. I mean, currently the major issues that I feel very strongly about and passionately about are things like the climate crisis. I think there's no shortage of public health stories that stem from the climate crisis, including the current pandemic that we are still in. And I think it's only going to get, it's only going to accelerate. We're going to see more and more of these kind of climate related public health issues. Some of the other issues and stories that I feel very strongly about are things around mental health. I think that's another sort of major public health challenge that the world is facing. And the intersection that I feel most, connected to or able to really engage with or speak to is the intersection between mental health and technology, both on the side of using technology to address mental health issues, which there's a lot of really great evidence on how, technology is really helping people to engage with different types of cognitive behavioral therapy. But also, technology is having, harmful negative effects from a mental health perspective on young people. And so how do we, tackle some of these issues in various ways, both from a, fiction story perspective, as well as sort of like a nonfiction storytelling perspective that can really help people relate and contextualize the issues around the things that they're currently experiencing.
Yeah, Patty, I love that you brought up this idea of expertise and experience and the role that plays in storytelling, because I feel like, especially since the pandemic, there's been this kind of unsaid trend of people who don't have relatable expertise or experience talking about their opinions. And I don't think that necessarily is the problem. What I think the problem is that those opinions are being presented as facts and as this kind of binary truth. And I feel like this is where you see a lot of misinformation kind of building. And, we've seen the impact of that in just people's trust with science and with government entities. So I'm so glad you brought that up. I think I also wanted to talk about how, when Rena and I were developing this question, something we thought about was, is this even a fair question to ask? Who are we to ask what stories are worth telling? And I think your answer to this question kind of shifted my perspective on the question to begin with, because it's not, the answer isn't, oh, well, this story is worth telling and this isn't. It's based on my experience and my expertise, I can confidently share a story about this topic. And whatever topic or experience is out of my realm, I'm more than happy to open it up for someone else to share that story. Would you say that's a correct interpretation of your answer?
Absolutely. And I think the more we can, we share from our own experiences, I think the better off we all are. I mean, I think oftentimes in academia, and I come from a very strong academic background, we tend to focus more on, peer-reviewed literature, scientific evidence, data, which is really important. I think a big challenge with that is that it's hard for sort of everyday people to relate to it. So when you're looking at, research data, it's often presented in this very like inaccessible way. And it does doesn't give a good picture of what the situation actually is, or like the impact that the situation is having on individuals. And in our life experience and our human experience, and the thing that we all kind of share in common is our like journey as individuals. And I think that's really why like storytelling really appeals to people. I mean, we start telling stories, or listening to stories from the time we're born, some even like before we're born, and so it's a tradition that has predated like any other tradition, in terms of really capturing individual experiences, collective experiences, and then finding ways of sharing those things.
Yeah, and I feel like this kind of is such a perfect segue to our next question, where I feel like storytelling is such a crucial component of just our life and traditions and experiences, but we often take it for granted in multiple spaces. And in my experience, I feel like public health is one of those spaces, because even for me, I didn't put two and two together until I want to say a couple of weeks ago, where my academic advisor was telling me, Fatiha, have you ever considered pursuing storytelling in public health? And I kind of blinked a couple of times and I looked at her and I was like, what do you mean? Like writing books? Or she was like, no, like there's so many mediums to storytelling, right? And you do it all the time. And just thinking about that got me thinking of, how would you say, or what would you say is the value of storytelling specifically in public health?
Yeah, I mean, I think, I remember my own sort of personal journey similar to you, and thinking about storytelling. I in a previous role, when I was the executive director of the M Health Alliance, I used to have to give a lot of talks about technology and health, and I have to say that I encountered this like very transformative moment when the person that I worked with on our communications was like, well, why don't you tell me some of your own personal stories related to mobile health? And I was like, okay. And it was really interesting because it sort of forced me to go back into my like own history with, you know, um, you know, my aha moments from, thinking about cell phones and health, to some of the early influences that impacted the approach that I took on mobile health, as well as my own use of mobile technology to access health information and health services. Um, but as soon as we started to include like my own personal stories in the presentations that I would give, or in the talks that I would have, or even in the processes that I would facilitate, it made such a huge difference, because it really brought the issues that I was, working on or tackling to life in a very different way, that people could really relate to. And I think so much of like public health is about, individuals taking action that then collectively, you know, either protects society or like reduces risk, from different potential harms. And so it's that collective, wisdom, that collective knowledge, that collective action, that's really, really needed. But I think a lot of that could really, really benefit from, creating platforms for people to share, to tell their stories, share their stories, listen to other people's stories. And as soon as I started doing that, people would come up to me all the time. They were like, thank you. Like, thank you for sharing your story. And, and then they would start sharing their stories with me. And I remember just being really encouraged by hearing, people's stories, even the really, really hard ones, which I think we also need to open ourselves up to and listen to, in order to, develop better, public health programs that are more responsive to the challenges that people are facing.
Yeah, I think that aspect of relatedness is so important because I feel like, especially during COVID time, it was all about the stats and the research and the numbers. And, I remember checking that COVID map and it just the numbers kept going up. And that just felt so far and distant from me. I'm like, okay, yes, these are people. I see a number on the screen, but it's kind of hard to humanize those numbers, right? Like you just get so used to seeing them and it's hard to connect those values and those stats with an actual living person. So I'm wondering, how can storytelling contribute to humanizing those public health events and all those numbers?
Sure. Behind every single one of those numbers, there was a life lived, right? And there is life lived, and there is like all of those like life experiences. Um, I remember there was a New York Times piece that was done when, I can't remember what the metric was, but I think it was like 100,000 people. I mean, we've now we're like 900,000, deaths, I think, in the is it 900,000 deaths in the United States alone, or 950 deaths in the United States alone. So some, insane number, but what they did was they took photos of all of those people and they had them, in the newspaper and behind, and then they, included in that edition like a subset of stories, of those individuals who had passed because of COVID. And to me, that, was like really eye-opening, because it took the numbers from these sort of very sort of inaccessible numbers into something that was like, wow, like the number of mothers, the number of children, who lost a parent, the number of, or grandparent. And so to me, those, really kind of came out in that process. And then also too, like, even when you heard the stories of like health professionals, and the health professionals who, day after day, like tirelessly, like making these like incredible sacrifices to provide care, to individuals was quite remarkable. I think one of my favorite stories was about like the kids who, were concerned about their elderly neighbors and would go grocery shopping, and deliver food to their like elderly neighbors. And so, like these are stories. These are, people's stories. It doesn't have to be, elaborate. It doesn't have to be long. It doesn't have to be, as you were saying, Patiha, earlier, like it doesn't have to be a book. It can be a book, but it can, it's just like what is behind the things that are happening and the issues that are happening, and how do they impact, individuals, and then how do they impact society in general. And those are all stories.
Yeah, I feel like, again, this brings up the point of so many of our life experiences we have a tendency to take for granted and not really recognize that it's a story in and of itself, right? I think we're on year 2 of the pandemic, I think. Year 2, that sounds right. And I feel like because I've just been living through it, it doesn't really hit me sometimes that this is a really monumental moment that I'm going to look back on and I'm going to say, wow, I was doing school, I was doing work, I was doing a podcast all throughout a pandemic, and like what stories they will produce. but I think another thing that I wanted to touch on that you had mentioned a little bit earlier in our interview was kind of fiction and nonfiction stories. And it reminded me of when I was in high school, I was reading a fiction book. I can't remember what the title is, but I remember my teacher had looked at me and said, "Oh, I would never let my kids read fiction books." And I was like, "Why? What's wrong with fiction?" And my teacher had said, "There's nothing to learn from fiction. Nonfiction tells you what actually happened. I would only let my kids read nonfiction books." And I feel like subconsciously that kind of changed the way I perceived fiction stories for a really long time, where I was like, maybe I should only gravitate towards like the sciencey, historical, self-help books. Well, what is a young author novel going to teach me about life? But lately I've been really challenging and pushing into that thought. And I'd love to hear what you think is the value between fiction and nonfiction.
Sure. I mean, think about your favorite books growing up, right? Like think about the writers that really touched you or moved you, or I mean, I bet you they were mostly fiction writers. And so, to me, like we need both, right? We need fiction and we need nonfiction. It's not even like an either or. It's just like when does it make sense to go in one direction versus another direction? And I think they can be like entirely complementary to one another. I think the beauty of fiction is that it has the potential to reach more people. I think it's more accessible. I think more people gravitate towards fiction for entertainment. And I think you can be really creative and artistic in fiction. I think one of the challenges that we've seen in fiction that is science related is that, like, science fiction, which is its own genre, likes to push the envelope, on like what is possible. But what we haven't had a whole lot of really good, like science inspired fiction. And I think we need sort of more and more of that. I think there's a real, opening for like science inspired fiction that can help make scientific topics more accessible to, the general public. And including public health issues. I think that we need sort of like more and more of that kind of accessible fiction type writing that can bring some of the issues closer to individuals. But it's not easy to actually do that. Like, I've spent a lot of the last few years learning how to write fiction, writing fiction, experimenting with different aspects of writing fiction. And, the trick to really good fiction, is either, character driven stories where you have really strong characters and you can get people to either really cheer for your characters or like despise your characters. And so then they're very curious about like what's going to happen in the story, and they want to follow the story and they want to follow the like path of the characters. And then you do have like really strong like plot driven fiction. And again, you can't get, one of the things that I've learned, from writing and rewriting, science based fiction or science inspired fiction, is that it's really easy to get like bogged down in the science. And it's almost like you have to kind of like lift yourself up from it, and really push yourself into the story and into the characters. And like, yes, the science is there and it's important and it's accurate and it's correct. But what people are really interested in, and what they're going to be really drawn to, are those characters, are those like plot twists and unexpected adventures and that sort of thing, and less so on the science, although they are learning and being exposed to science along along the way. And then, with nonfiction, I mean, I think it's like preaching to the choir, but like, we need nonfiction because facts are important. Like it's important to have, facts and science and evidence and all of those things, out of which you can then, really think about how do you make it more accessible to like a much bigger group of people who aren't going to go, find the peer-reviewed literature to understand what, is really happening with, certain types of public health conditions and issues.
Yeah, I think that idea of strong characters is super important. I didn't really think about it because looking back at the novels that I've read, I mostly remember the characters and what they went through. And so that's a great piece of advice. And it leads me to think, maybe autobiographies could also be a good medium, learning about, people's life and experiences with healthcare or an illness or something. And I'm actually taking a class right now. It's called Lives in Medicine, Exploring the Personal Writing of Patients and Practitioners. I think it's a really long title. But this class is really new and exciting because the whole class is a reading and writing class, but we're reading books written by physicians and patients and kind of, learning about their experiences and then comparing the two. And it's really interesting because I've learned a lot more about healthcare and public health through those stories than, sitting in a class and listening to a lecture. So I think it's really valuable what these stories can provide. And that kind of leads me to my next question is, who should we be hearing these stories from, right? Like in my class, we've heard from both doctors and patients, and some people will argue, oh, one is more valuable than the other. But I'd like to hear what you think. Who should we be hearing stories from?
I mean, I think we should be hearing stories from as many perspectives as we possibly can. I think it's really important to examine issues from like multiple sides, including the complete like naysayers, right? So the people who are like antagonistic to the issues that we're trying to address and work through, and maybe even like more so the antagonistic people, so that we can really figure out like what are they experiencing or challenged by, etc., that needs to be addressed through better public health messaging, programming, service delivery, etc. In my books, I have multiple narrators, which I think is really, really important, to look at almost like the same story, but from very different perspectives. So whether it's male and female, or different age groups that you're looking at, or different life experiences, etc. And so I do think that it, where possible, I think it is important to have, diversity in, representation of experiences and stories. And I think we all become, richer for being exposed to different perspectives than that of our own.
Yeah, I feel like we've hit so many great points about the value of storytelling, right? I feel like we constantly are talking about like value, and there's so much to learn from stories, whether or not they're fiction or nonfiction, whether or not they're from the same narrator or different perspectives. But I also feel like there's a danger component to storytelling. And I think it would be important for us to talk about, what are some of the dangers about storytelling that people should be cognizant of, so they're not consumed by it completely, both good and bad.
Yeah, and I think there are dangers in storytelling, and I think we're starting to see some of them kind of come to light a lot more now, than ever before. I think it's important to make sure that, especially when looking at science inspired fiction, that the science is correct, right? So you don't want to like fictionalize it so much that it becomes science fiction. You want to make sure that it is science based. And then you also want to make sure that you're not, especially if you have characters that are of different races, etc. You also don't want to increase bias or play to stereotypes when you're creating characters. But you also, for me, I think it's been really important that you also want to express diversity in writing as well. And so having diverse characters has always been really, really important to me. But it's also a risk because you need to make sure that you're not inadvertently, bringing in any stereotypes or biases. And so it's really important to engage with people, from the different races and perspectives that you're representing, to just make sure that like it's totally above board and not like increasing stereotypes, etc. I think it's also important to be critical thinkers of storytelling, and consider the biases that come from the storyteller, and become critical thinkers about who is the storyteller and what potentially might their biases be when it comes to a specific issue. And so it's always really interesting when in the writing circles, when you hear about like men writing novels from the female perspective or women writing novels from the male perspective. Like, should we stop people from writing from different perspectives simply because they're not of that perspective? I don't think so. I don't think that's like a valid, like it shouldn't be that like only if you are, of a particular, construct, are you entitled to write about those things? But I think we also have to think about, question ourselves as well as, what we're reading, to, think about like, where is that narrative coming from? Where is that story coming from? Whose story is it? And be critical about whatever biases or potential biases may come from that.
Yeah, those are great points. We recently did an episode about, looking at different research sources and just sources in general, and being able to think through, who's writing the source, where are they coming from? And, that's all really important. I'm glad you bring it up. There's also another aspect I feel like about storytelling that might not get to you until a bit later. And I think that's more of like the emotional component. Like I just finished, it was called My Own Country by Abraham Verghese. And this book was about a physician during the outbreak of the AIDS endemic. And he goes into depth about all of his different patients. And ultimately in the book, they pass away. And reading those really sad stories, it really gets to you, right? Like I was crying in my bed because one of my favorite patients in the book passed away, and it really gets to you at some point. So I guess in that aspect, how can we keep in mind of the emotional components while getting the most out of these stories?
Well, I think the emotional component should not be feared. I mean, I think the emotional component is the component. Like it is the thing that, I think, I feel like historically, like we've been told that like emotions need to be controlled and emotions are bad, or emotions are, like everybody has an opinion about emotions. And to me, like emotions are emotions. Like it's not about whether or not they're like bad or good. They're there. They're what we're feeling. They're what we're experiencing. And they're the things that compel us to do what we do, right? And they sort of put a fire in the belly and make us more passionate about like the work that we're doing. And so I don't actually see the like emotional component, or even being like emotionally attached to things as necessarily a negative. I mean, I was recently reading the most recent Brene Brown book, which is like Atlas of the Heart, and one of the challenges that, you know, she articulates in the book is that we don't have enough words to describe the emotions that we experience in life, to then be able to like work our way through those emotions or harness those emotions depending on like what we are doing. And that most emotions have both a very positive and a negative side to them. And so I think that one of the things that I, you know, have learned like in my own life, because I was definitely, you know, one of those people who was as much more on the emotional side of things, a more sensitive person, you know, and having spent most of my like early, you know, childhood being told to get thicker skin, I think it is my sensitivity and my emotions that actually make me really good at public health, and also good at fiction writing, and really trying to get into like the emotional depth of characters and individuals and empathize and really feel what it is that, you know, people are feeling and experiencing. And I think that is the beauty of storytelling and, you know, story listening, and then kind of like embracing that as part of, you know, what we do and how we approach the work that we do.
Yeah, your thoughts on emotions being a part of storytelling resonated with me so deeply. And I just feel so affirmed as someone who's also really sensitive. I feel like growing up, I've just always been told you either think too much or you feel too deeply. And, you know, now, you know, learning that emotions are just emotions, both good and bad, and that it makes experiences that much more valuable has been so liberating to me. That, you know, if I'm sad, I'm sad. There's just no else. Or if I'm happy, I'm happy. And I agree with you. I feel like it makes listening to experiences that much more enriching when you're able to connect with them on something that is deeper than just the experiences, right? Because I feel like it really helps you connect with people who are not like you, right? If I'm reading a book about, you know, different autoimmune disorders that I might not have experience with, you know, relating to that emotional aspect and tapping into maybe worries or fears or uncertainties or just different thoughts in general make the experience that much more fulfilling. So I'm really glad you touched on that. And I think, you know, we talked so much about listening to people's stories and the dangers and the values. What I kind of want to address this question of people who maybe have a lot of stories to share, but are sitting there going, I don't know what to do. I don't want to write a book. Maybe that's what they're first thinking, right? How would you encourage people to share their own stories and experiences with health, or maybe even beyond health?
Absolutely. I mean, I think, you know, I think in everyday life, I think it's good to introduce stories into conversation, introduce stories into examples of things that you're. I think we've lost something in interpersonal communication in our super teched up world. And as much as I love technology, I also think it has created this like barrier to communicating. So I think personal anecdotes make a huge difference in interpersonal communication. So I would start with like talking to people about, sharing your stories and listening to their stories, or asking them, asking people for their stories. I love, talking to like older people and learning, kind of like what, their life experience was like. And, or even to kids, and kids will tell you their stories, and, they're excited to share their stories with you. And so I think it's important to just even start from like the interpersonal communication side of things. If you're inclined to write and you like to write, even things like starting a blog, or a video log, or those sorts of things can go a long way. I think there's lots of ways to capture, things in story. I think art also can enable people to tell their stories or share their stories, whether it is, painting or drawing, or sculpture. I think the arts provide this, incredible platform for sharing of, sharing of stories, as well as music. I think, I feel like there's so many creative media that you can think of where you could, potentially share stories. But I think even just, talking to your friends or talking to your parents, or even sharing stories as part of the way that you communicate in class as a student at Hopkins, I think could also enrich the learning experience as well as your own learning experience.
Yeah, these are all great tips. I didn't even think of art and music. I feel like I hear storytelling and I hear, pencil and paper. So yeah, thank you so much. I've learned a lot, and I'm excited to, look more into storytelling and public health. I think this has been super valuable, and I really hope for anyone who's listening that it'll be valuable for you too. Before we close, we kind of want to end on a fun note. Patty, you used to be a Hopkins student when you were in your 20s, and so we're wondering, if you were to look back now, what would you tell your 21-year-old self?
Don't take yourself so seriously. I feel like it was such a serious time when I was at Hopkins, and there was like so much pressure to, excel and do everything, be everything, etc. I think if I were to go back, I would just, tell myself that, one, it's all going to be okay. You will figure it all out. And that, your 4 years, in school are like a small part of a much larger journey, that both came before, and will come after kind of your time at Hopkins.
Yeah, and thank you so much for everything, for just being willing to be on our podcast and share such valuable information about storytelling, and for the advice of not taking ourselves too seriously. That's gonna be my mantra leading up to spring break. I really needed to hear that. So thank you so, so much. We really do appreciate everything that you've talked about today. We hope that this episode empowered you to reflect on how you can connect your own personal stories with public health. For more information about storytelling techniques, please visit our website, withthepodcast.wordpress.com. To share your thoughts and interact with us, follow us on Instagram at withthepodcast. We appreciate your support. Thank you to Dr. Patty Michelle for taking the time to talk with us. We hope you will join us for our next episode.